Welcome to another one-on-one on Talking Feds. We find ourselves in the Kennedy era, not JFK, not even RFK, but RFK Jr., who was Trump's narrowly confirmed and controversial choice to head Health and Human Services Agency, where his idiosyncratic, I can start there, ideas have been given full play in certain areas. So I wanted to take the chance to describe what's going on, both the risks and plain anomaly of some of the things he's doing and what's happening in public health. And we have the best person, I'd say, in the world to do that in Dr. Kavita Patel. She's a teaching professor of medicine at Stanford, a board certified internal medicine physician, but she knows government, having worked in the Obama administration as the director of policy for the Office of Intergovernmental Affairs and Public Engagement. And you see her often on podcasts and as a contributor to NBC News and MSNBC. Can I call you Kavita, Doctor? And thank you
Please,
for joining.
please do, Harry, and flattery will get you everywhere, especially
Uh,
with the tired internal medicine doctor. So
yeah,
yes.
I'll bet that's right. You're holding down two real jobs, right?
Yeah, they're
Yeah.
definitely real, but also uh, we can speak about how like all of what's playing out, RFK Jr. and kind of the messages as well as the kind of grants ending, how that's affecting like the research and physician community because it's
Yeah,
pretty.
which is what I was hoping to do. So we are, it seems, staring down a cascade of possible outbreaks of infectious diseases, and the U.S. federal response seems, I'll go with reckless here. Let's start with the surging measles crisis. It seems like the measles virus is spreading. It was in Texas, then New Mexico, Maryland, California. It's incredibly contagious. That much I know is just apparent, and it's spreading in 15 states, spreads very easily through the air. How worried should, let's start here, vaccinated Americans, most Americans are vaccinated. How worried should we be just about what's happening on the ground?
Yeah, Harry, overall, if you're vaccinated, and we can talk about like some nuances of when you were vaccinated, but if you were vaccinated and you recall, maybe not from birth, but you know that you were up to date on your
Yeah.
vaccinations, which is usually two shots, you are fine, except an asterisk, doctors like to do, but the populations that I would personally have no problem kind of recommending go out and get another vaccine, which you can do at any pharmacy. I would feel very comfortable kind of over the age of 80, just because your immunity does decrease pretty dramatically around that age,
Mhm.
especially from vaccine immunity. So 80 and above, I think, including my parents, I think that's a great time to just go get another one, including if you were going to be in what I'd call high risk areas, which is essentially the entire United States, but in like, large gatherings, let's say
We're
weddings,
densely populated areas.
densely
Yeah.
populated
Yeah.
areas. So a little bit of that COVID refrain. And then if you are someone who is pregnant, you cannot get it. So I would make sure everybody around you is vaccinated because you want them to be a protective wall. And then if you have children who are under the age of 4 or 5, they probably only got one vaccine. You should take them to their pediatrician and say, I'd like my second. You can get the second 28 days after the first. So those are my asterisks. So
All right, no, 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 but that's basically good news. Until the vaccine came around in I think early 60s,
yeah,
basically that was just a normal incident of American life, including occasional
right.
fatalities.
That's right.
And it infected nearly all children. Um, but I had understood, you say if you're vaccinated, Kavita, but that there's this magic, pretty high percentage, I've heard 95%, that at that level we have so-called herd immunity.
Right.
If it's the case that a lot of people don't get vaccinated, is everything you said still true? And what is the sort of practical effect of dipping under the herd immunity magic percent number?
Yeah. So that's what we're kind of watching play out in real time right now because the communities where we are seeing like just breakthrough or kind of like smaller numbers of infections, so not West Texas and New Mexico, but 12 other states where we are seeing cases. Those are places that are not blowing up because we have that community kind of herd immunity, 95% is like the kind of commonly touted number, but the truth is it's just this, 93 to 95, 93 or higher is probably the kind of perfect number. On top of that, though, your point is well taken that if the community levels are lower, it's still your individual shots will still work and they could provide immunity, but there might be a higher chance of what I'll call breakthrough infections. So about 5% of measles infections are in people who are vaccinated. Why does that happen? Just more virus has like more opportunities to kind of ping and try to infect people. But what we know is that the vaccine is still working just like it did with COVID. It's helping to make sure you don't die or end up with encephalitis or end up blind or end up deaf, which are serious consequences of measles infections. So the point that you bring up is that if we're getting lower and lower in certain communities, there are higher chances of getting an infection, including even amongst vaccinated people. So it's a very good reminder to everyone.
All right, so let's cut to RFK
Yeah.
Jr. I think listeners can decide for themselves. He surely hasn't completely abandoned the weird, although he sometimes gives lip service to the conventional. Here, he's talking about vitamin A, and that I think as a substitute for immunization.
Mhm.
Dr. Patel, I'll call
Mhm.
you doctor now.
Yes. Yes.
What do you think? How is this quackery?
There are zero studies, zero, not even in the search criteria, zero studies about using vitamin A or cod liver oil, which has some of the kind of vitamin A, or beef tallow or anything as a substitute to prevent measles, period. The only thing that can almost truly prevent measles is a vaccine. So
Yeah.
that the reason, and I think this is important for your listeners, which are very like, I think your listeners appreciate the honesty. The honesty here is that what RFK Jr. has done is taken like a very small kernel of truth, which is that the World Health Organization does recommend that if you're suspected of having measles, that you should actually take vitamin A supplementation because the World Health Organization is trying to help the entire world, in which many pockets of the world are vitamin A deficient in their nutrition. And that instead of some of the more sophisticated techniques that we have to actually understand, like, are they vitamin A deficient or not, they recommend to just go ahead and do supplementation. But let me just repeat, that's upon infection,
Right.
not to
Right.
prevent it. And number two, it's very specific in the WHO guidelines. It's in under-resourced areas. You could argue parts of America are under-resourced. I would concede on that. But again, some small kernel of possible truth spun out into
Well,
like a
it's
very
enough to
large
be
lie.
dangerous, right?
Right. And that's what
And
happens.
yeah, and I actually want to bear down this a little bit, just in general, because I'm sure you've been dealing with this for your whole life. What is it that makes certain, and RFK Jr. seems like a perfect case in point, except he is now the
Mhm.
highest uh, federal employee for health and human services. The appeal of sort of urban myths that depart from what medicine has taught us about different treatments. It really seems like in almost any area. My mind just flashed on Andy Kaufman when he had
Yes.
lung cancer, and
Mhm.
was it late? I don't, but you've seen this probably your whole career.
Right.
Is there something in as you've observed it that just makes people grab at weird unconventional treatments when where medicine is concerned, which should be the place you would think you're kind of most conservative?
Yeah, and we see this phenomenon. Some psychologists have kind of tried to like talk about this. It's like a combination of like the Dunning-Lore effect.
Hmm.
Dunning-Lore
We
effect
all know
as
what that is. I'm
yes,
just
exactly.
kidding.
It's the effect of, well, I'm going to go ahead and say
Yeah,
it's like the
yeah,
effect of like kind of assuming you know a lot more than you
yeah,
do. And then and so we see a little bit of that playing here. By the way, doctors are guilty of that, where I'm guilty of that, where we sometimes think, well, Harry, I know a lot more about these things than you do. So let me
yeah.
go ahead and tell you, even though you actually might be the expert in this. So we're seeing some of that at play here combined with What I will, again, I'm trying to be more honest, about what we do well and what we don't do well in all settings. I think that the healthcare industry for too long has been patriarchal. We do a lot of like, well, Harry, like, I'm the doctor, you should just listen to me and you should just do kind of what I tell you. And I think in that, like, kind of in that sliver that's now grown into this giant chasm has been disenchanted people who feel like they've been like wronged, outliers, people who feel like they've been maligned because they are not conventional thinkers. By the way, some of those are very smart scientists that have been alienated for their kind of beliefs. What is unfortunate is that I try to kind of go back to like, what do we have with the data so far? It is not perfect, but what do we know about fill in the blank? And I think what you're seeing from the MAGA and MAHA movement, which is, I couldn't believe how much traction this would get quickly. You're seeing this sense of individualism that I should not follow these evidence-based guidelines, Harry, because I know myself best and nobody else can tell me about me. And that has been like something that's proliferated. By the way, we saw it in the, I'd say 80s and 90s. You mentioned Andy Kaufman. We saw it very famously with Suzanne Summers, the actress, in
Yep.
treatment of breast cancer. We see it in these pockets. It's just now we've got we have a larger group of those pockets that are aggregating, combined with now, unfortunately, policymakers who have these incredible levers to be able to like turbocharge them. That's the
Yeah.
difference.
And it really dovetails with just the deep antipathy toward and mistrust of government in
Government,
the age of
CDC.
Trump. So it must,
Yep.
CDC must be out there conspiring. Okay.
Right.
Um, so as of now, well, just a closing question with measles are, do you see an appreciable risk of like a outbreak of something that
Yeah.
as you mentioned in individual areas
Mhm.
could breach the magic number of 93, 95, or
Yeah.
just for now it's kind of eye-popping that we have as many cases as we do, but I'll put it this way, it's just the number one public health issue today.
Totally. Yes, and I think it's also it's almost a beautiful in a very kind of scary way. It's this
Yeah.
just manifestation of everything you and I have been talking about, mistrust of government institutions, this kind of individualism, like lack of a sense of like community responsibility, right? And then also like, oh my God, Harry, these are like measles kills people. It is killing people, and yet we're still like very blasé, like, hey, just eat better and be, eat
Yeah.
fries made in beef tallow, and then you're going to be
Yeah. I shouldn't
fine, Harry.
laugh. it's
So
it's tragic.
but
Yeah.
but so
Yeah.
it's almost just like this beautiful, bizarre representation of all those themes intersecting. So yes, I think so. I've talked to like some very close kind of epidemiology colleagues. We've been trying to guess what's the number going to top out. We have already had more cases of measles to date this year than all of 2024 total. So we were trying to understand, to your point, what's the depths of this. I do still think we're going to see hundreds more cases, but I hope we get to some sense of that brick wall of immunity. I just don't know when that will be.
Talking Feds is supported by the Brennan Center for Justice. In this new political era, the Brennan Center will do what they do best: defend the Constitution and the rule of law. They're prepared to fight against presidential overreach and will continue advocating for reforms to resist weaponized government, stop billionaires from corrupting our elections, and ensure every eligible American has the freedom to vote. Stay informed by visiting brennancenter.org.
Okay, so I guess we just have to watch it closely and keep talking to you.
Mhm.
There are a couple other issues that are, I think, not quite as dead center, but they certainly caught my eye as I prepared for our discussion. So, bird flu. The and here Kennedy is, well, his proposal is, I gotta say, jaw-dropping, which is basically bird flu. It's a good thing. We're going to let the virus rip through poultry populations so we can find the birds that survive. Well, both how catastrophic an idea is this in general, and then do you have a sense of the tangible danger here? How the odds that we'll get lucky and just this benighted advice, won't
Yeah.
actually result in the deaths of thousands or more of Americans.
Yeah, you're right. So one thing is I did now it's funny how much I'm resurfacing old memos. I didn't steal them
Right.
from the White House, but old memos that I had like seen
They
or
were gonna, otherwise
reviewed.
they were gonna delete them
They
anyway.
were going to
That's the
delete them
whole theme. They
anyway
just want to get
about
rid of them.
they
Yeah.
do
Anyway.
about H1N1. So H1 what we have right now circulating is H5N1 in
Hmm.
like the early, in the 2000s, 2010, 11, we thought it would be H1N1 that could present the pandemic that would shut down the world. Obviously, it was COVID. But I think that we do have a risk right now as it stands. We actually don't have like a shelf-ready vaccine that could be mass disseminated that is effective against this exact type of strain of the bird flu that's circulating. And there's been mutations that's been getting some news, but
Already, I see.
in general, we don't have what we have is kind of older versions that will likely work, but we really don't know. That's the truth.
Older
And then
versions of a vaccine.
of a
Hmm.
vaccine. So we would have like a, fingers crossed. And then not to mention that we've also now been subsequently defunding and doging parts of the government that would be critical to a rollout of a vaccine or to a, let's call it, mass kind of vaccination like we tried to do with, like we did do with
Yeah.
COVID. So to me, this threat of bird flu, every day, every single day, I wait for the tweet, like the tweet or the X post or something on Blue Sky that says, here's human to human transmission. So the key for the listening audience is that all the stories of bird flocks here and this farm there, they worry me, but they worry me because I'm waiting for this story that the virus has gotten smart enough that it's figured out how to go from human to human. And what that means is that obviously a lot more humans will get it. It's a lot like COVID. Most people will get like a nasty eye infection, a bad cold. But then there, unfortunately, are people who will get hospitalized and die. And
Yeah.
so this all could be a recipe for disaster. Every single day, I worry that I see that tweet and there's the first case. And then I'm like, deep breath, what do we do next? And I
Yeah.
truly don't know what we would do next because the very infrastructures that I normally would depend on, we don't have.
Yeah. And that, I mean, that's exactly what happened with COVID. At some point, it went from bats
Mhm.
or whatever, it went human to
Mhm.
human, and
That's
then
exactly right.
yeah.
Mhm.
All right. Well, look, what I won't even say, what would a conventional, not even a Patel led, but just until 2025,
Uh-huh.
what would a conventional governmental response to what is, so far as you say,
Yeah.
a really worrisome but fairly
Mhm.
small risk?
Mhm.
What should be happening? I recall, was it the a flu, was it the swine flu, where it never got big, but we had a whole huge
Right.
vaccine program. What would you expect a responsible set of federal officials to be doing now?
Yeah, I think that so what we should be doing right now, and it's not clear kind of since things have been dismantled, we should be in the World Health Organization at the table so that we can actually understand what's happening, not just here, but in the world.
Yeah.
Because recall, some of our best research about bird flu came from the Southern Hemisphere, South Africa, from Australia. Like we were dependent on some of the public health infrastructure that we were connected into through the WHO. So WHO seats so that we have a participation at the global table for feedback both ways, not just America helping others. It's really about the kind of cycle. Second, we would be really critically thinking, nobody wants to talk about prepping for a mass vaccination. Nobody does, but we need to. We need to at least do the tabletop exercise. What I would be doing at HHS right now are all the kind of tabletop exercises for all the scenarios and having every checklist kind of, check, 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 check. I'd be gathering the clinical community on a regular basis. You can do that through the Surgeon General, you can do it through a number of figureheads, but I gather them to understand how do we set up a sentinel network. We learned with swine flu, great example. We learned with COVID that we didn't know what to look for and kind of how to test and who to ask and when to test and do this. Have like us work with agricultural officials so that we can actually learn from what they've been doing or not doing. And then we can plan and prepare as clinicians and as a front line and then work with the governors. I mean, we learned this too late in COVID, right? That the governors were trying to negotiate. I had Larry Hogan in Maryland trying to get masks from South Korea. You
Right.
had Gavin Newsom trying to get ventilators over there. Get the governors together and just say, we know that your list of problems is very long. we want to make sure your state's ready. Here's a template for things that your state officials should be thinking about.
Yeah, I mean,
That's
that's actually that part. I'm no doctor, but as a law enforcement agent, I've participated in these tabletop exercises because you could have the vaccine here, and okay, now let's give it to everybody.
Right.
How that works, and literally exercises where this goes awry, this truck turns over. I mean, to not be having to make it up on the fly when an outbreak is occurring in the country.
Yep.
Okay, let me
There you
ask you about another scary acronym, TB.
Right.
Tuberculosis, it was once the deadliest infection in the US. It still claims, this blew my mind, over 1 million lives a year. And here the worry is not the homegrown crazy ideas of Kennedy, but just the general xenophobia and pulling away from the international community. So we're gutting funding of international tuberculosis programs, which we historically led. So, just in general, you think of that sort of rhetorical posture on Trump's part, and then all the ways in which foreign policy to public health, it has real on the ground consequences for people. But what is, as you see it, I mean, you just mentioned we're not being at a table that we really should be at. But I know everyone's petrified in the public health community about the growth of some kind of antibiotic resistant tuberculosis strain. What do you see as the relationship between that risk and our general withdrawal from the world community, including the public health community?
Yeah, and I think you cited a couple of statistics. I think what's important is the piece that we're all afraid of is kind of what we call multi-drug resistant tuberculosis. There was an outbreak in 2023 of 13 cases that actually made like the CDC case report for that week, because the very, that number was alarming, because we're seeing that was in Kansas City, where we also still have an ongoing, it's been like a smoldering but increasing numbers in the last 6 months. So we've seen this smoldering of cases and higher case counts of tuberculosis each year, 15, 25% in the United States. Let's address what you just said. It's not like, people are bringing this disease in. Like, we're doing a pretty good job of not taking care of it here. And so I think that it represents a couple of things. Number one, we don't really kind of talk about TB. We think of it as like, the disease of like the 19th century. It's very much still active and alive. And on top of that, what we have to do is make sure the treatment forget multi-drug resistant, but the treatment for tuberculosis often involves what we call direct observed therapy. It's so important that people take weeks of a daily kind of antibiotic regimen that often we will send a nurse into a home or into the street, if that's their residence, to watch them taking their antibiotics, because that's how you get drug resistance. If you don't take it, that's how you don't get rid of TB and you continue to spread it. I think the point that some authors have recently brought up is that, number one, the World Health Organization is usually the backbone of thinking about how we have a plan for multi-drug resistant TB and how we can like have a research effort to kind of tackle that. That now is kind of obviously being dismantled. The second part of this is, to your point, of just this like NIMBYism of like, well, that doesn't happen here. That's not something we have to take responsibility for. Plus the Epidemiologic Intelligence Service. What I'll say to listeners that's just important to note is that in every part of not just the federal government, but what worries me even more is that you're seeing this at universities, red and blue states around the country, where they're also fearful that if they conduct this kind of research, that they will be targeted. So you're seeing just for some reason, like this, labeling of this type of research as not worth our time or somehow viewed as bad. And that has now translated into a perception that TB is not important to concentrate on. And funding has been gone from states and counties.
Well, I mean, and the ravaging effects, let's say they really follow through with some of these ideas to pool $5 billion or so from Columbia. I mean, we're talking about project after project after project the federal government funds, and usually with a pretty big ratio of miss to hits, but essential stories. Let me just close here. I wanted to talk to you because I heard about measles and its spread, and just thinking about what to ask you. I'm seeing bird flu, I'm seeing tuberculosis. It's only been a couple months. what's your general, and I think some of the nature of your concerns with both with who's heading HHS and a sort of general isolationism, or you might say exceptionalism and how that plays out in public health. But what's the even worse sort of nightmare scenario? It's just been these three, but are you watching in particular for specific kinds of diseases that might come back again? Or I assume that if everything goes awry, we're not talking just about measles, bird flu, and tuberculosis. What's the general landscape, just objectively, but on a, what's your paranoid scenario here about the whole situation?
I think
Does that make sense? Yeah.
It does. It does. I think the paranoid scenario, a lot of like infectious diseases that can largely be prevented, whether it's by vaccines or just good like screening and prevention.
For example, what's give me a,
so
three or four infectious diseases.
I'm going to give you Neisseria, chlamydia, gonorrhea, often thought of as sexually transmitted, often thought of as sexually transmitted infections, but Neisseria there are different types of Neisseria meningitis, which is usually something that we vaccinate college-bound students for because it is seen like kind of at that age, also shared in like dormitories. So I think these are all the rise of bacteria and viruses that could largely be preventable. I mentioned gonorrhea and chlamydia. We haven't talked about Mpox, formerly called monkeypox, in a while. Mpox, a lot of the like curbing of Mpox was from vaccination, education. Mpox. It was formerly, when it was first kind of when it was first documented in like cases 2 years ago, it was called monkeypox, and then just to reflect like what it actually is. Now called Mpox.
Man, that sounds scary.
It does sound scary. Things with the word pox in it sound scary. They should.
Or monkey also.
Monkey doesn't sound good.
I didn't say up front that you have a specialty in your podcast in words, and words
yes,
matter.
I do.
And,
they do. So it's true. The words. So Mpox. It does sound bad. So and then Ebola, like viruses that like have no business having spread. But the theme here is that when you cut off USAID, when you cut off the WHO, when you cut off the CDC, when you cut off agencies that many of your listeners have never even heard of, the Agency for Healthcare Research and Quality, AHRQ, these are all agencies that form this kind of fabric of what keeps us safe. The things we take for granted, like highways and electricity. And then when they go down, as Harry, you've experienced, when there's a big giant pit hole in a highway, or when your electricity goes off and doesn't come back on for an hour, the public is outraged. That's what I worry the equivalent of that for infections absolutely will happen, because we have no reason to protect against it right now. So you're relying on a very burnt out, tired workforce, doctors, and I don't practice full time because I would burn out, but you're relying on a very burnt out workforce to do everything. And that's a recipe for disaster.
Kavita Patel, so illuminating, if unsettling to talk to you. I hope we'll have a chance as things develop, maybe maybe we catch a break and keep rolling sevens, maybe not. Really appreciate your time.
Thank you.
Thanks for tuning in. If you enjoyed this video and other Talking Feds content, please take a second to like and subscribe. Talk to you later.